Welcome to Organizing Life's Daily Demands. My name is Peter Gordon. I'm the president of New York Financial Organizers. We're daily money managers. We help people pay their bills, file insurance claims, do budgets. We do all the non-investment side of personal finance. We like to say we organize life's daily demands. The purpose of this podcast is to interview other professionals who help people organize life's daily demands. And this morning, I'm very happy to introduce Robert Rawdin, the smile specialist. Hi, Robert. How are you doing today?
Oh, great. Thank you, Peter. Thanks for having me on.
Yeah, well, thanks for being there. I guess I'm continuing the theme of my recent podcast where I have members of a group called BNI that are professionals who help people organize life's daily demands. And Robert is a phenomenal dentist, and I'm looking forward to having this conversation. So, Robert, could you tell me, how did you get? I mean, it's a long story, so keep it, short. How did you get into dentistry, and where are you now?
Okay, so briefly, dentistry for me, it seemed like a natural fit as far as a career choice for me. I always loved science as a young student. Science, biology was always something that really intrigued me. I also loved arts and crafts and working with my hands. And I'm a people person. I like to work with people. Helping people is obviously a wonderful thing. So, putting these my likes and desires and so on together, I'm like, dentistry would be a perfect fit for me, and it really has been a perfect fit. I am 40 years into my career, and I still love it. I've really stayed, very current with what's going on, the advances in dentistry, and we've built a fantastic group practice with a lot of technology and a lot of amenities to really cater to patients' needs and try to do things really efficiently. So for me, it's a wonderful profession, and I'm going to keep doing it as long as I can. I'm healthy. I enjoy it. My daughter practices with me. That's a blessing, and it's a wonderful situation.
Yeah, I was going to mention that we share that in common, that we work with our children, or some of our children, that's unique, and it's interesting. Tell us about the composition of your office staff.
So, as I mentioned, we're a group practice. So, when my daughter graduated dental school, I was in a relatively small office, and there really was no room for growth, and it was going to be very difficult to kind of get her busy and have her, be very productive in the practice. I merged my practice with a colleague of mine who was in a big office, and turns out that his daughter as well is in the practice. So we have two dads and two daughters, and then one other associate dentist. So there's five of us. And 2 years ago, we built a new office. We had to leave the building that we were in. We're here right in Midtown Manhattan. We were on 57th Street. Now we're just a block west on 56th. And we found a really great space, built out a new big office. And it's fabulous. It's a beautiful place to work. We've got, a lot of staff here to help us support what we're doing. Front desk people, laboratory. We have our own laboratory on site, which is really a big advantage. And
Wow,
really,
that's huge. That's huge.
yeah, it really helps for the efficiency of what we can do. And patients, once they come in and understand what we can offer, it's really they appreciate it, and it works really well.
You should say that out. I mean, you might have said it and I missed it, but at our meeting when you introduced yourself, that I know from my experience going to dentists, well, I have to send it to the lab, and when it comes back, and so you save so much time by having your own lab.
Yeah. There's so much that we can do on the same day. I mean, we're set up we've invested heavily in digital technology. And like I said, we really stay current with what's been going on in dentistry. So the digital technology is amazing. You can come in with a broken tooth. We can do the preparation, create a crown for you while you're sitting here in the office. And within a couple of hours, you come in with a broken tooth and you'll leave with a complete ceramic, brand new crown created here in the office and finished. So you don't have a temporary.
That's remarkable.
Yeah, we work so well. We've been, riding this technology wave for a long time, and it's just gotten better and better. And we figured out a great workflow for it. We've got 4 dental technicians working in our lab, and as I said, we've really invested in the digital equipment and the technology that is necessary in order to do this. So from simple restorations to very complex, you can't get implants and teeth and so on in a day like a lot of the advertisements. But all the planning, we can do that and execute things really pretty quickly and on a very efficient basis.
Is that real, implants in a day?
Well, it's advertised a lot, but what they don't tell you is there's a lot of planning that goes into it. So it is possible to, let's say, remove bad teeth, place some implants, and put a temporary bridge, a temporary restoration on those implants. It's not the final prosthesis that you're going to be wearing. So when implants are placed, you really need to give them adequate time for healing.
From personal experience.
Yeah, so you need at least 3 or 4 months once the implants are placed. So you're utilizing like a temporary type of restoration during that time period, 3-4 months, whatever it be.
Okay.
And then the permanent restoration can be created. So when they say teeth in a day, yeah, there's a lot of planning before. The day that all that's done is done in one day. Teeth can be extracted, implants placed, and so on, and you walk out with a temporary restoration. So
Right.
the technology, has lent itself to be able to do this, but it's not like you come in and everything is done, like your final teeth restorations are done
No, I get it now.
the same day. It's that's not feasible. Yeah.
How do you keep up with technology?
So I've always been very involved in continuing education and the organized dentistry. The societies, academies, and so on that are around. So I'm a specialist. I'm a prosthodontist. That means I did additional training after dental school, and prosthodontists specialize in restoring and replacing teeth. So from one broken tooth to a complete mouth rehabilitation on teeth or on implants, dentures, bridges, things like that. So I've always been involved in the prosthodontic specialty groups, local dental groups, and so on. So there's a requirement for continuing education, but I've really had a desire to really stay on top of it. And my partner, as I mentioned, when we merged practices, he was really into the technology and developed, one of the first offices with a laboratory that really communicated with the clinical part of the practice in order to create teeth in the same day, crowns in the same day. And since, we've been together for almost 10 years, and it's evolving because technology is evolving, and we really try to stay on top of it and offer, the best we can. It's the best for the patients, health and care, but it's also the best for us as far as knowing how to do it efficiently and making it easier. A lot of people are fearful of the dentist, and
That's an understatement.
if we can minimize how much time they have to be here in order to get things done, they are thrilled with that prospect, that possibility.
Sure.
Yeah.
And I know you mentioned about the office and the people work there, and from my experience, that a good office staff makes a huge difference. And I know I've heard about your practice from others that it's enjoyable to go visit. That the people who work there really care, and you're taken care of, and you're put first, and that's critical.
Yeah, we've tried to really foster an environment where, Yeah, what we do is centered around the patient. The patient is coming to us for our, you know, expert care and skill and so on in order to take care, maintain their dental health, or, sometimes it's very involved and they're here, often because of the level of care that's necessary. But, from the first phone call, when somebody calls an office to make an inquiry, they've got to be greeted by someone that cares, wants to be as polite and empathetic as possible. And we really try to create that culture in the practice. Everybody, they know what we do is centered around what the patients need. And in private practice, patients are coming in and spending good money to get top care, and that's what we're always trying to deliver. Always trying to offer the best that we can.
Got it. Um, and I think it's kind of obvious, but what makes your practice great for busy New Yorkers?
So we're open many hours a week, which is something that makes it easier for people to schedule. We start at 8 a.m. in the morning. 2 days a week we're here till 7 p.m. And the other day, 2 days we're at 7. We finish at 7. 2 days we finish at 6 p.m. And on Fridays we're out at 3. The other thing is we always have a few dental hygienists that are working in the office every day. So 3, 4, or 5 hygienists can be working in the same day. So getting an appointment to fit into your busy schedule is, we try to make it easy to accommodate people. And as I mentioned before, doing same day crowns or veneer or things like that for a patient. Just a quick example, a woman I know on a rainy evening fell and cracked 2 front teeth, and she was in my office the next morning. She called and left a message. We got her in early, pretty much early in the next day. I was able to restore both teeth, start to finish. She was out of the office within 2.5, 3 hours or whatever.
That's remarkable.
And she's a busy professional, and she it's like I can't spend a lot of visits to do this. But she was so concerned and upset about what happened. We were able to do it, and she came in the next morning. She's back out. Yeah, she was still a little bruised and so on because she fell and slipped and hit her face. But we got the teeth back together. Everything else healed. She was delighted and so thankful that we're able to do that. Yeah.
Amazing. So you talked about technology and how you utilize it. And what are some of the latest advances? I'm always amazed when I go to the dentist and I see, they really are the cutting edge, the dentists I've been to. And there's always something new. So what are some of the latest advances in dentistry?
Really everything in the digital world has been advancing. The digital scanners that we use, that we take images of teeth, are so precise, and it's not instant, but it's so quick that you can capture images. New patients come in and we take a digital record. We take photos of their teeth and so on, but we take a digital record. So I know exactly what your teeth look like the day that you came to see me in my practice. Changes that are happening, we can look back and evaluate it. When we're creating these, same day crowns and so on, we use digital scanners. We don't have to take impressions. A lot of people have experienced that. It's the goopy stuff. It's sitting in your mouth for, at least 5 minutes. It's not the most comfortable thing in the world. So the digital scanning, we use it for teeth. So for crowns and veneers, we use it for all the implant restorations, because the accuracy of the scanners has gotten, it's amazing. And then the technology, that we have in the laboratory to create the crowns, to create bridges that we're making, the implant restorations that we're making, it's all done in-house. The other thing that's new that we've been using for a while now is a digital facial scanner, like a three-dimensional scanner. It's not just a static picture. So when we're designing what someone's smile looks like, we can have the 3D image of the patient's head smiling, and we know exactly where the teeth are supposed to be. And when I'm working with my technicians in the laboratory, we can have that design of the teeth placed into your mouth, into your face, and we can rotate the head around and kind of look at you. We've got the perfect avatar of you on our computer screen. I don't need you to keep coming back. In the past, there are ways to relate the position of the teeth to, a true horizontal line, and you look at it in relation to your eyes. But when you're designing it and you've got the lips, you've got that frame, the facial aspect, it just adds so much to what we can do. And again, it's an efficiency method to really get these things done.
Yeah, that's amazing. That's it's as I said, I'm always in awe of the new technology at the dentist. Well, Robert, that was great. I really appreciate your time. Tell us, I mean, your information will be in the podcast host or on the video, but below the video on YouTube. Tell us the best way that people get in touch with you.
So our practice is called CitySpireDental. We're in the CitySpire building on West 56th Street. It's 156 West 56th Street. Our website is CitySpireDental.com. The office phone number is 212-246-8700. If anybody wants to, call us directly. My email, if somebody wants to send me a question, or I could provide information, dr.r, so dr.r at CitySpireDental.com.
Yeah. And I can attest to the fact that Robert is more than happy to talk to people about any issues they have, whether it be their mouth or not.
Whatever I can do.
Yes. Well, again, thanks very much. And I really appreciate your time. And I'll see everybody at the next podcast video. Thanks.
Well, thank you, Peter. Appreciate it.
You're welcome.